Narayana Health promotes advanced medication in Bangalore. World-renowned Hospitals Group Narayana Health venture promoted by Dr Devi Shetty, known for its advanced medication in areas of critical care, has demonstrated its accomplishments in the areas of neurosciences. In order to retain its lead of treating 1 lakh patients for neuro disorders by the Narayana Health team, a team of experts in terms of doctors, lab technicians, nurses and supporting staffs continue their foray in offering advanced care, performing complicated surgeries in treating and therapies. In order to celebrate its achievement to touch 1 lakh patients, Narayana Health has organized a press meet at ITC Gardenia ballroom this afternoon, in the presence of expert doctors whose expertise made the Narayana Hospitals in achieving 1 lakh mark. On the occasion, doctors presented success stories that evolved them to achieve greater feat, which encouraged patients from the situation of hopelessness to hopefulness. Incidentally, acclaimed Bollywood celebrity singer Lucky Ali made a guest appearance as he was treated and his appearance as a satisfied patient. Speaking on the occasion, Lucky Ali addressed the audience as a privileged patient of Narayana Health. He said, timely treatment and early diagnosis and timely treatment could prevent complications in medications and surgeries which demand some kind of self-assessment. On the occasion, he narrated his own experience at Narayana Health.
Good afternoon, everyone. Thank you all for being here today to mark this important milestone by Narayana Health. 100,000 neuro procedures. It's a significant achievement, and I'm glad to be here to share this moment. Also, as an ex-patient, I would say, of Narayana. Just to share my story. I was driving one night from Goa to Bangalore. At around 2 o'clock in the morning, I just felt very, very tired. And I found a difficulty in movement. So my family acted very quickly and took me to a hospital. And a scan confirmed that it was a TI, reversible thing. So I underwent a carotid stenting procedure done by Dr. Devi, a painless procedure. And I learned that with timely treatment and proper follow-up, these symptoms gradually reversed, and I was able to return to my normal life with music. This experience made it clear to me that a stroke or a TI is a medical emergency, but it is treatable and it is also preventable if it is caught early. And acting fast really matters. I'd like to thank Dr. Devi, all the nurses and doctors and the entire team at Narayana Health for the care I received. Their calm and professional approach made a big difference in how I experienced my treatment and recovery. So to anyone going through similar situations, don't delay seeking help. Early recognition and timely treatment can change the outcome. Recovery is possible and life can go on. So we're back to where we were. Thank you so much.
Difficult to manage epilepsy patients today. So this is a story of a young female who presented to us 3 months back, and she continued to have convulsions that continued beyond 4 to 5 weeks, and she was managed in our center. So this is the story of a 21-year-old student. In the month of June 2025, she was admitted in a local hospital with fever and headache, and subsequently she had seizures, that is convulsion, or that we call fits. Subsequently, she progressed and she continued to have convulsion despite treatment in the local hospital. This is called a super refractory status epilepticus. It's a rare and dangerous neurological emergency. The brain gets exhausted, these patients get silent seizures that we can understand from continuous EEG monitoring. After getting many convulsive episodes, these patients do not get overtly visible convulsion that a doctor or the family members can identify. These patients become comatose, and that we can identify by doing continuous EEG monitoring. And that's how we understood that this patient was in continued convulsion despite not having convulsion from outside. Subsequently, doctors, neurologists and critical care specialists, as I discussed, and we successfully discharged this young girl. and she was conscious, oriented, and she was able to walk independently at the time of discharge. Currently, she is under my follow-up. She is back to her university and she is studying well.
Audience here. So we have individual persons taking care of individual type of cases. So my interest is more into what we call as movement disorders. So in this, so I cater to patients who have problems with abnormal movements like tremors, twisted posturing of the limbs, who have difficulty in walking. So I cater to those patients. That's my area of interest. So let me show one case. He was a working male. So he slowly started developing this an abnormal movement of his upper trunk. So basically, what was happening is he started having backward arching. It was in rare condition. We tried all the oral medications available, didn't work. So as a next step, as a second line, we tried injecting these patients with the injections called botulinum toxin. Generally, it helps in mild cases, but in patients who have severe truncal arching, but no benefit. So he was coming. So just to tell about this, we also call it a segmental dystonia. So this is a rare condition in terms of the incidence. It happens 1 in 10,000 people. So in 10,000 people, only 1% gets this. Why it happens, we don't know.
You need to rush to stress. It is a treatable condition. So I thank Dr. Devi Shetty sir and Rupert and all the senior management and the entire neuroscience team and all the teaching technical staff, nursing, everyone and all the doctors who have supported us for giving this opportunity. And I also thank Dr. Lakh for coming here and blessing and us, and without God's intervention, nothing can be done. And I want to conclude. Thank you.